I work in an area called denials prevention. So in addition to using the MCG criteria to write clinical argument letters to the commercial payers to convince them on why they need to pay the account, I also review the client's use of the product so that if they need to fine-tune some of the way that they're using the criteria, I can kind of coach them a little bit in that process since I've used it for many, many years. It's a great tool for active use, but it's easy to educate others on how to use and prove their case because providers have a right to get paid for the services that they're giving to the patients. I get the cases after they deny, but then I review case studies and present those case studies back to the client and help educate them on the clinical aspects and maybe some different methods of using the criteria, different components, make sure to use the tools that are embedded in the criteria. I particularly like the RRG criteria components because insurance companies will tell you the first level of criteria they go to is the observation criteria. And so you're right off the bat, you hit the ground running trying to prove the case is inpatient. And those RRG criteria sets are super helpful when you need to truly look and compare that clinical documentation to the criteria set to support your level of care for that argument. And the insurance companies have a hard time arguing against that when they say they use MCG guidelines as their evidence-based practice model. I remind them that that is the tool they chose and that they need to follow that and honor this bill and pay that client.